Hey doctors, what I want to go over today is the stack and rank. This is a monthly document that we put together that shows us how the doctors across the organization are doing. So I wanted to walk you through that. Hopefully your office managers have shown you this document in the past. If not, when we see each other, I'll bring it up for sure. And let's dive right in. When we take a look at this document, what it shows is it has a list of the doctors, and then it has their collections and their days worked, and then on the far right column it has their average daily collections. And so by doing it on an average daily, what we're able to do is we're able to compare doctors that work here maybe 1 day per month versus compared to doctors that work here 4 days a week. It really doesn't matter how frequently you work here, because we average it out by day. We're able to compare the numbers evenly across doctors. The next thing that we'll notice is it's broken down into 3 different sections. So again, the doctors are ranked from the highest daily average to the lowest, and they're really put into 3 different buckets. We've got kind of like the whatever face bucket in the middle, and we've got the sad face bucket at the bottom. So I want to talk to you about the 3 different buckets, what they mean, how we came up with those buckets, and then what we see typically for doctors that are in each of those buckets, so that we can, especially for the bottom 2, we can look at moving up. First one, sad bucket. Sad bucket is a doctor that's collecting less than $3,200 per day in collections. And when we're collecting less than $3,200 per day, we're not meeting our daily rate. So we're not in bonus territory. We're typically building up in our buckets, as opposed to getting paid out in bonus. And so this is an area we definitely do not want to be in for any given length of time. This is an area we want to get out of. Definitely want to be above that line there. The next line here is between $3,200 and $5,000 a day in collections. And that's kind of our normal bucket. In this range here, we're getting a bonus in our paychecks, and that's nice. And the reason we have a cutoff there at the 5,000 is because I think that for a doctor that works 4 days a week and takes 2 weeks off per year, their paycheck, their W-2 at the end of the year, their 1099 at the end of the year, should be $250,000. If you're averaging $5,000 per day, you can do the math. At 4 days a week, 50 weeks out of the year, that's $250,000. And so that, for me, that's kind of like the minimum that I would like to see a doctor making, working full-time 4 days a week at the company. That's this chunk here. They're in bonus territory, but they're not quite breaking through that $250,000 per year barrier. And then those doctors that are at the top, these are the doctors that are making in excess of annualized, making in excess of $250,000 a year. A lot of our specialists will be up in this line, as well as several of our GP doctors. I think usually on most years, our top producing GP doctor is somewhere in the $500,000 range take-home pay. And they would typically almost always be in this top bucket. All right, that's the 3 buckets. Again, this is like the great bucket. I think this is where we would all agree. This is where we want you to be. The next bucket is like you're doing well. You're in bonus territory, but there's definitely a lot of room for improvement in order to get into the top bucket. And then the bottom bucket here, this is like we want to get out of this as quick as we can. We do not want to linger in that bottom section any longer than we have to. We want to get into bonus territory as quickly as possible. Some of the characteristics or things that we see in working with several dentists, obviously there's several dentists in each of the categories, and we see some things that are similar between the doctors that are in the different categories. So here, I'm going to just talk about the doctors that I see at in the bottom that are not yet in bonus territory. This could be, your first few weeks at the company, insurance payments haven't started coming in yet, fine. That's not really what I'm referring to here. Some of the things that I see for doctors in the bottom category. First thing, we're not doing comprehensive exams consistently. Okay? And so when I go through, so if I were to, for example, for the doctors in the bottom category, if I were to just randomly choose 10 new patients that these doctors saw, 8 of them would have had comprehensive exams and 2 would not. They would have limited exams because, I'm just coming in for the pain on my lower left. If I go up to the doctors at the top, 100% of the patients that came in would have a comprehensive exam, 100%. So going from 70 to 80%, up to 100% as far as the comprehensive exams are concerned. Let's talk about what a comprehensive exam means, just very briefly. For me, the comprehensive exam basically means, of course, you're looking at all of the teeth in the mouth, and you are including procedures that you do not currently have the tool in your tool belt to fix. So what does that mean? That means ortho, implants, root canals, other things that you might not have the ability to do. Do they end up on the treatment plan or not? And so in a true comprehensive exam, they should, right? So if you see the wisdom teeth on there and they need to be extracted, they should be on the treatment plan, even if you're not the one that does it. If the patient needs ortho, even though you don't do ortho, it should be on the treatment plan. So that's what a comprehensive exam means. Second thing is, if I were to go around and I were to look at all of these doctors in the bottom category, what I would see is lots of scrubs, I don't know what to call them, like track outfits. It's kind of like, it looks like they're ready to go to the gym as soon as work is over. Some sort of jeans or some combination thereof. It's almost like jeans and a scrub top. It's kind of a ridiculous looking thing. If I go up to the doctors at the top of the list, what I would see is a lot of shirt and tie, a lot of lab coats, a lot of professional looking, these look like doctors, right? It's not like all the young people are at the bottom and the older people are at the top. That's not the case. We've got a mix of ages across the different groups. But what's different is the people at the top of the group present as doctors. People at the bottom group present, looks like maybe they're in some sort of a training rotation, right, wearing their scrubs. Next thing, if I were to go and I were to take a look at the bottom of the list and I were to listen to them talk to the patient, I would hear a lot of options being given. I would hear a lot of, well, maybe next time you want to think about, we can take a look at this. Let's wait until the infection goes down and then we can consider doing something. Whereas if I go to the top of the list, I'm going to hear a lot of, today we're going to be taking care of this. Today we're going to do this. A lot of confidence given to the patient around the treatment that's being recommended. If you or my sister, this is what I would recommend we do. Today we're going to take care of this half of the mouth. This is what we're going to be doing in that area. So a lot of confidence, a lot of today, we're going to take care of it today. That's what I would hear. Next thing, bottom of the list. I know that my 11 o'clock new patient that comes in is probably not going to have any sort of significant treatment done today. And my 5 and 6 p.m. new patients that come in are probably not going to have any significant treatment done, because that would run into the doctor's other things that they've got going on, lunch or going home early or things like that. Whereas at the top of the list, I know that when the patient is in the chair and they've got the checkbook ready to go, that work is going to get done, right? So strike while the iron's hot. Even if you were to push them out to tomorrow, a lot of things can happen between today and tomorrow, right? They may, they may go home and suddenly their wife has a friend whose, brother's in-law is a dentist, and you should talk to him first to get a second opinion on the thing. The pain might go away. See that all the time, right? It's like urgent pain. I got to get this taken care of. And suddenly the nerve's kind of dead. And so I don't really have any pain anymore. So, it magically fixed itself. We see these kind of things all the time. So the doctors that handle it today, patients ready today, money in hand today, handle the treatment today, they end up being closer to the top of the list. And a lot of the doctors are kind of pushing things off until later, till the infection subsides, until it's not my lunchtime, until the stars are aligned perfectly in the sky, whatever the case may be. Their numbers tend to be on the lower end. One thing for the doctors that are in this middle bucket that we see that has helped to get doctors from the middle bucket to that upper bucket are the larger procedures. So a lot of times if I go through a month of procedures for a doctor in the middle group versus a doctor in the top group, what I'll see is the number of like fillings and crowns and root canals and things like that are the same, but the doctor in the top category is going to have a couple of these big killer cases, the $20,000, $30,000, $40,000 cases. And that's really what ends up driving them above the line. In order to do those cases, it's tough to have a $40,000 case on crowns. It's just really, really tough to do. However, implant-supported overdenture case, slam dunk, right? If you have that plus some sinus lifts, it could be in excess of that. The larger like implant cases, restorative cases, those types of things where, they're large cases where in a single 4 or 5 hour period, you're collecting $20,000 or $30,000. Those cases are what I see drive doctors from the middle group up into that top group. And so that's a combination of a couple of things. One, it's the clinical skill set in order to be able to do that. And again, so for our VIP doctors, if you're sitting in this middle group, we're going to be looking to get you trained up to be able to do those big cases so that you're able to then jump up into the top group. The second thing is the confidence in talking with the patients, right? And you don't need to have a lot of confidence to convince somebody that's in, screaming pain and stayed awake all night last night in order to get their root canal done, right? You just have to say, yeah, I can do it, and they're going to go along with it. a $40,000 restorative case where you're going to be pulling out the remainder of their natural teeth and replacing them with dentures, implant supported dentures. That's they need to feel that confidence coming from the doctor. Having that confidence chairside and then being able to express that to the patient, combined with the skill set, obviously the clinical skill set, in order to be able to successfully complete the case, is really kind of the magic in getting those, 20, 30, 40, $50,000 cases. I look forward to seeing you guys. Go over your individual numbers, see where you're at, see what we can do to bump you up into the next bucket. Thank you very much.